Deb, if we can ask you to unmute, and we look forward to your question for Dr. Dale Bredesen. Hi, Deb.
Hello. Hi, Dr. Bredesen. My question has to do with how we can get the information out in a speedier way. I live in Arizona, and there's a lot of assisted living facilities, and people that aren't really experiencing any decline are going in just because it's more of a convenience situation. And it just seems like a good potential portal to do your protocol in some of these assisted living facilities.
Wow, Deb, that is such a great question. Thank you for asking that. And I do think this is the future. You know, we want to get, think about this. Going into an assisted living facility has always meant one thing. You're going to go downhill, and you're going ultimately, unfortunately, going to pass away. This has been a terminal illness. The idea now is let's have people who go in and then get help and then come back out again. That's the goal. And so I don't know, are you a member of RALNA? Do you know RALNA, the Residential Assisted Living National Association? There are over 14,000 members of RALNA. So you might want to contact RALNA. So we've just started working with RALNA to make it so that we have this protocol accessible to as many assisted living facilities as possible. Now, you brought up a good point. People go in, the earlier they go in, actually now the better in terms of getting people to do the right things and hopefully getting them back out. And I should mention, there's one facility that's been started in San Diego, which is called Marama, M-A-R-A-M-A. It was started by Dr. Heather Sanderson, who's trained with us and is an ND herself and has done a fabulous job and has dealt with many patients. And so she thought the same thing, and she actually set up the first such facility in which she brings people in, and then she's had very good results. And in fact, she pointed out to me a number of months ago that the people in her facility are not declining. So very exciting results. This is just at the beginning. And boy, wouldn't we all love to see fewer people who are going downhill in these assisted living facilities. Now, the one negative, as you already know, we want to get people even before that. So therefore, one of the things to do as you see people in the assisted living facility, and hopefully if you can say to their families, they're going to stay sharper longer and to be able to interact with you for years and maybe even get out of the facility, that would be the hope. But even if they don't, they should do very well for a long time, and you can have more time with your loved one. We also recommend, please make sure, since this is now, you're seeing that someone in the family developed cognitive decline, please get the members of your family evaluated so that you literally end the problem with the current generation.
Thank you, Dr. Bredesen, for that. And up next, we have Janine. Janine, if you can go ahead and unmute yourself, please. Hi, Janine.
Hi, hello. Thank you very much for your lecture. I live in Australia, and I've recently lost someone to Alzheimer's, and I had never heard, and I don't believe they were ever offered any sort of functional medicine, so I don't even know if it is here. But my actual question is, you did mention ketosis, and I don't think you quite got to that. How do you recommend a protocol for that? Is it a plant-based ketosis?
Yes.
Or fasting every now and then? I'm sure the meat and cheese ketosis isn't the most healthy way to go. So I'm just curious about ketosis for a health perspective with Alzheimer's.
Yeah, great question. Thank you very much, Janine. So first of all, yes, we've trained over 2,000 physicians in 10 different countries, and a number of them are in Australia. You can look at Dr. Dave Jenkins, for example. Look up, there's a book by Peter Dredge, whose wife improved on our protocol, and he wrote about it. And then again, we go into this, what we use is called Ketoflex 12-3, but again, we're agnostic, whatever helps the patients. And so the biochemistry is that it helps people to become insulin sensitive. It helps them to have specific phytonutrients. So yes, here are the combinations. So number one, we want to target mild ketosis. It is a plant rich. You can be a vegetarian or a vegan if you want. You don't have to be. You can have some fish, some grass-fed beef, some pastured chicken, but whatever you do, the biochemistry is toward driving you to mild ketosis. And then you want to have high fiber. That improves glycemic load, as you know, glycemic index. It improves your lipid profile. It helps you with detox. lots of good things about having that fiber, improves your microbiome. So prebiotics and probiotics, very helpful. Of course, without a leaky gut, we want to make sure that you heal your gut as well. And this was all part of this trial. And then you want to have fasting. Fasting is critical. It is supportive for getting rid of that amyloid. It is supportive for having an anti-inflammatory effect on your brain. It is supportive for helping to get you into ketosis. So all of these things work together to improve your outcome. And again, there are absolutely people in Australia who are doing this, a number of people who have trained with this. So yes, please, I'm sorry to hear about your family, but please make it so that everybody else gets evaluated and gets on early treatment or early prevention so that you never see this again in your family. That's the goal.
Thank you, Dr. Bredesen. And up next, we have Denise. Denise, if you can go ahead and unmute, please. Hi, Denise.
Thank you so much for such an informative presentation. And I wanted to ask, I'm sure you know about also the work of Dean and Aisha Sharzai. And
Sure.
I wonder if you could tell me regarding the nutrition portion of the Sharzai's program, do you have any agreement with them in terms of the nutrition? And one other little adjunct with that is, when you were talking about choline, I was just thinking about how so many of our doctors, Dr. Kim Williams, for example, alerts us that we really don't want to eat choline because it helps create TMAO in our bodies, and that's not good for our heart or brain. So if you could maybe address that, I'd appreciate it. Thank you.
Yeah, thanks, Denise. So yeah, a couple of things. So we'll talk about choline and then we'll talk about Sharzai's. And so the choline, again, you want to get the right amount, not too much, not too little. You don't want to have a ton of extra, but again, remember, TMAO is much more of a problem for people with a lot of meat in their diet, much less of a problem for people who are more vegetarian. So at the same time, you don't want to be low in choline, because the most important neurotransmitter in Alzheimer's, which is low in Alzheimer's, is acetylcholine. Acetylcholine is the most important neurotransmitter for memory. So we don't want to be low in choline, and you're absolutely right. We don't want to be so high off the charts that we're increasing our TMAO. Now, as far as the Sharzai's, we have some areas, and I think it's important. We're all trying to see improvements in cognition, and I respect what Dean and Aisha are doing. I respect what Dean Ornish is in the middle of his own trial for cognitive decline. But I should say that when we've all written books about this, but what we've published is we're the only ones who've published a study. So we published in 2014, we published 2016, so we're the only ones who've published results. Everybody else is saying, well, we read this and this is good idea, this or that's good idea. We all need to be publishing. And as I mentioned just a few slides ago, this is why we all need to be doing clinical trials. And again, as I said, Dean is doing one. It is going to come out it's going to be finished in about a year. His is very different. It's going to be just lifestyle for, the question is, can lifestyle help cognitive decline? With Dean and Aisha, they have their own approach, whole foods, that sort of thing, which is fantastic. They tend to be not as interested in ketosis, and they've written in the past that they believe that ketosis can contribute. Now, again, we would argue with that, and I think at some point it would be great to have all of us in the same room talking about this and say, why each one of us thinks that our approach is going to work. But again, the bottom line is we're all interested in the same thing: reducing the global burden of cognitive decline. And I think we're all seeing some results. I'd love to see the publications when they're ready from the other groups, because that's the only way to prove. Otherwise, you're just making claims. We want to prove these claims by publishing them in peer-reviewed journals. We continue to believe, and we see again and again, the people who do the best do get into ketosis, and they do this more plant-rich, high fiber with appropriate fasting. Now, again, I think it's important to realize there's not necessarily one right answer. Anything that's giving you good outcomes, just like we've heard about the fact that some people who've done very well with longevity have had high carbohydrate diets, high complex carbohydrate diets, of course, Others have had very low carbohydrate diets. So there's not just one way to get a good outcome, but you need to understand the underlying biochemistry that's going to give you, and neurochemistry that's going to give you best outcomes. And that's why we did the trial, and that's what we're seeing with these people.